Greetings, my name is Dr. Dessler Javier, and I'm your Program Director here at Advocate Illinois Masonic Medical Center. It's a pleasure to welcome you to our wonderful program. This residency program has a special place in my heart, as I graduated from Illinois Masonic back in 2015. Afterwards, I became Associate Program Director and now Program Director over the last several years. Over this time, I have firsthand witnessed the program evolve into what it is today, an incredibly strong collection of diverse residents and faculty dedicated to the advancement of your careers in internal medicine. Year after year, our residents match into competitive fellowships across the country. Furthermore, hospitals leads say our residents are one of the most prepared groups of physicians ready to enter the rigors of hospitalist medicine. Whatever your career paths are, know that the training over the course of 3 years here will prepare you for what lies ahead. With a vast array of learning opportunities that include case conferences, workshops, topic presentations, morbidity and mortality conference, and simulation lab, the medical education you receive in conjunction with the excellent and safe patient care you provide gives you the tools you need to succeed here at Illinois Masonic. Our subspecialists in areas such as cardiology, endocrinology, hematology, oncology, and others participate in developing your skills and medical knowledge as a physician. You will learn the latest in clinical guidelines and practice them firsthand daily. Furthermore, here at Illinois Masonic, we are one of the first internal medicine programs in the country to bring you the Lifestyle Medicine residency curriculum created by the American College of Lifestyle Medicine. You have the unique opportunity of obtaining double board certification in both internal medicine and lifestyle medicine by the time you graduate. In the end, residency can be a tough and difficult transition toward the destination point in your careers. However, I am comforted in the fact that our culture here at Masonic fosters an environment of teamwork, accountability, and overall collegiality that makes this the ideal place to learn and grow together. Enjoy the rest of our presentation as you learn about the Advocate Illinois Masonic Internal Medicine family.
The core objective of our residency program is to impart robust, inpatient experience in floor rotations, including general medical floor, telemetry, step-down, and intensive care units. We have a dedicated rapid response team aided by a rescue team to respond to stroke alerts, RRTs, and medical codes. You are given a lot of autonomy in making clinical decisions, especially on nights, and are backed in a supportive environment, so you feel safe in asking questions and making mistakes as interns that enables you to grow into a competent clinician.
The Medical Intensive Care Unit consists of 14 beds and is managed by 2 intensivists working closely with the IM residents. Our daily multidisciplinary rounds include an ICU attending, residents, interns, nurses, pharmacists, case managers, and therapists, giving the interns an opportunity to learn a wide range of complex clinical cases while the senior resident is involved in the care and management of these complex cases. Being in the ICU brings experience and knowledge that perhaps no other rotation does. With the perfect balance of autonomy and support, along with many opportunities for procedures such as arterial lines, central lines, thoracentesis, and chest tube insertions, a month in the ICU is sure to make you think independently and take emergent decisions on your feet.
The dedicated X and Y curriculum ensures 2 weeks of uninterrupted time for continuity clinic, where the residents and core faculty work together to foster long-term patient relationships and manage outpatient medicine. This block also emphasizes didactics by means of morning reports, workshops, journal club, and sim lab. Our newest facet we are extremely proud to be a part of is integration of COVID recovery clinic with the resident schedule, which has given us the opportunity and insights into the long-term effects of the COVID pandemic. What we particularly love about these 2 weeks is the time we get to spend outside the hospital, especially after intense inpatient rotation. As a new intern, what benefits us the most is the dedicated time to practicing real-life scenarios in a safe and controlled setting.
One of the highlights of being in the clinic block is that we get to practice real-life emergencies in our sim lab, where the interns and the newly minted residents get to practice these emergencies in a very safe and controlled setting, so they feel very comfortable when it happens in real time. For me personally, being in Y block means it's 2 weeks of downtime where I get to spend time with my friends and family after an intense inpatient rotation and kind of catch up on all the things that Chicago has to offer.
Another focus of our program is the opportunity to rotate within various subspecialties. These include oncology, cardiology, gastroenterology, nephrology, neurology, infectious disease. Rotating through these specialties gives you a great exposure into the disease process and intervention that may not be available on general floor rotations. In addition, the POCUS curriculum helps the residents be more comfortable using bedside ultrasounds for common diagnoses.
Most of our didactics happen within the Howard Clark Auditorium. These include our morning and noon conferences, journal clubs, M&M, grand rounds, multidisciplinary conferences, and senior project presentation.
I think one of my favorite things about Masonic is that we truly are a family. It was something that was very important to me looking for residency, and I don't know if it's the close amount of time that we spend together. I don't know if it's all the trial and tribulations that can come with residency, but I've developed some of the best friendships that I've had in many years here. I know that they will carry with me throughout the rest of my career, throughout the rest of my life. We will revisit the times where we were fresh interns and didn't really know what to do, where we became seniors and we faced all these new exciting challenges. We've had each other through celebrations, birthdays, life events, weddings, births of children, and we've also had each other when we really thought that this was a really hard road, where we had a difficult time with one of our patients. I think those are things that I will never be able to replace, and Masonic, at the end of the day, whenever I go into my next step, will always be my family.
So as the popular saying goes, all work and no play makes Jack a dull boy. So one of the greatest things I like about this program is location-wise. We are located in one of the best, if not the best and most vibrant neighborhoods in the north side of Chicago, called Lakeview. This program is located just a walking distance from Lake Michigan, where you can have a lot of things to do over there, from kayaking to boat riding and to playing volleyball. In fact, we even have a volleyball team where we usually go and just hang out there after work. We are surrounded by a ton of restaurants. And when I say restaurants, I mean from anywhere that you can think of, from Southeast Asia to American to European, whatever dish you can think of, you can find it around this neighborhood. We're also located just, as I said, a few minutes from Chicago. Literally the train station is right in front of the hospital, where you can take the Brown line to the Loop in less than 20 minutes.
In addition to providing an excellent learning environment and fostering personal growth, our program is committed to diversity and prioritizing wellness. Thank you for your interest in our program. We look forward to welcoming you here.